If you're a woman and suffering from hair loss, it could be due to iron deficiency. Fortunately, you can do something about it. I'm Dr. Mazhar Hussain, and this is my hair clinic. So let's talk about iron deficiency and hair loss in women. Hair is a non-essential tissue for the body. It's not important for our survival. The body is going to prioritize other tissues that are more vital for its survival and for its health. So if you're deficient in iron, it's not going to be the highest priority for the body to ensure that you have good hair. Keep in mind that the hair follicle is a very metabolically active tissue. It's among the most metabolically active tissue with a great cell turnover in the matrix of the follicular bulb. Well, the bulb is what we usually call the root of the hair. It's part of the growth center of the hair. But with the high cellular turnover, there's also a greater need for nutrients. If the iron is not sufficient, it will impact on the growth. And we know from a number of studies that hair growth is greatly affected by nutritional deficiencies. It could be protein malnutrition, it could be caloric restriction, it could also be micronutrients such as iron. So we don't exactly know what the mechanism behind this is. It is being theorized that maybe it could be due to iron playing a role in the enzyme that is called RIBONUCLEOTIDE reductase. This enzyme is very important for the DNA synthesis, and it could be that is the reason why iron deficiency affects hair growth by reducing the production of DNA. Symptoms of iron deficiency vary greatly. You can have symptoms from the skin, and hair is just part of the skin, and you can have more generalized symptoms from the body. For instance, from the skin you can see graying of the hair. You can see hair loss that could mimic male pattern baldness or female pattern baldness. You can also get brittle nails. You can also have more generalized symptoms such as weakness, tiredness, cold feet, cold hands. And if the iron deficiency is severe enough, it can lead to a higher heart rate. The body will try to compensate the low amount of iron and the lower hemoglobin by increasing the heart rate so that the supply to the body tissues is not being affected. So you can have a higher heart rate and irregular rhythm. You can also see something that's quite weird, you would say. You can have cravings for odd things. You can have craving for ice, but you can also have craving for clay and dirt. So that is quite an unusual symptom in terms of symptoms for medical illnesses or deficiencies, but that is seen in iron deficiency. Iron deficiency can be due to a number of reasons. For instance, it can be due to blood loss. Blood loss can very frequently be seen in women due to heavy periods, and we can also see it in people that frequently donate blood. People with frequent nosebleeds or gastrointestinal bleeding can also have blood loss sufficient to cause iron deficiency and iron deficiency anemia. It can also be due to other factors such as lower bioavailability, and here I need to mention especially vegetarians. Plant diets contain a high amount of non-heme iron as opposed to heme iron that is seen in meat products, in animal products. Non-heme iron has a lower bioavailability, and that means that vegetarians should have 1.8 to 2 times more iron in their diet as compared to non-vegetarians. So that is something you need to keep in mind. Another factor that can impact on the bioavailability and the uptake of iron is vitamin C. If you're low on vitamin C, it can affect your absorption, and you need to ensure that. If you're a vegetarian and you're low on vitamin C, of course, that can even make it worse. Now, another reason for iron deficiency could be, for instance, in cases of pregnancy, you need to supply your body with iron sufficient to cover yourself and cover your child. The fetus also has a great need for iron. It's growing, and you need to ensure you are taking enough. Also, after the pregnancy, if you're breastfeeding, you need to eat enough, you need to take enough iron to supply yourself and the child with iron through the breast milk. The diagnosis may not be straightforward always. Although there are many symptoms that could indicate iron deficiency, it's not unusual for iron deficiency to develop more slowly, and the patient may not notice actually. And if they go to the doctors with some vague symptoms, it's not uncommon to take a complete blood count. In the complete blood count, what we may see in cases of iron deficiency is it could be low hemoglobin levels, it could be a low hematocrit level, which means basically the volume that the red blood cells take up in the blood, the share of that volume goes down. It could also be that the individual red blood cells are smaller in size. Those are all things that we can see in the complete blood count, and it can give the doctor a hint that maybe we need to investigate further, maybe we need to look into the iron levels of the body. Now, if we decide that we need to investigate further because of the complete blood count, what we'll often do is we'll look for iron levels in the blood and we'll look for ferritin levels in the blood. Ferritin is the storage of iron in the body. Now, keep in mind there can be situations where you might have a high ferritin level, and it's due to, although you have low iron levels, ferritin can increase as a response to acute inflammation in the body. It's called acute phase reactant, and it can falsely be higher and indicate maybe your iron levels are okay while they're not really. So you can't just use one test and conclude from that you're iron deficient or you are not iron deficient. You need to see the whole picture. So how do we define iron deficiency? If the ferritin level is less than 40 micrograms per liter in men, or if it's less than 20 micrograms per liter in women, we would consider it to be iron deficient. Or on the other hand, I recommend that you stay at around 50 to 70 micrograms per liter. So what is the treatment for iron deficiency? Well, you can change your diet so that you take in food with a greater amount of iron in the diet. Foods rich in iron include red meat, it includes fish and poultry, chicken, turkey, duck, and so on. Especially the liver and other organs would have a greater content of iron. Apart from that, green leafy vegetables such as broccoli, kale, and spinach will also contain a greater amount of iron. Nuts also have a greater amount of iron, so I can certainly recommend that. Apart from the diet, as we talked about, you can also take supplements. The supplements need to be adjusted to your specific needs. What is your situation? How much do you need? And bright colored vegetables and fruits will contain a great amount of vitamin C, such as oranges, grapefruits, strawberries, melons, papaya, mangoes, and other fruits. What are my recommendations then overall? So if you're suffering from androgenic alopecia, and keep in mind, androgenic alopecia, you might think, well, that's something with men, isn't it? Androgenic alopecia can be seen in men and women, and in men it's called male pattern baldness often, and in women it's called female pattern baldness. I do strongly recommend that you take iron, and rather I recommend that you have sufficient amount of iron in your blood to give the hair follicle the best possible conditions to produce hair. Further, if you're experiencing premature graying of your hair, in that case also I would suggest that you take iron, because that could be a reason why your hair is graying before than is expected. So if you're suffering from hair loss, I strongly suggest that you have your iron level checked, especially if you're a woman, because that could be the reason, or at least partially the reason, why you're losing hair. I'm Dr. Hussain, and this is my hair clinic. Thank you for watching. If you're male and suffering from hair loss, it could also be down to iron deficiency. So I suggest to check out our video on iron deficiency and hair loss in men. Keep in mind that we do offer online consultations, so do let us know if you can help. Do subscribe to our channel, click the notification bell so that you're updated with our newest videos, and do share this video with your friends and family.